We will talk about Quality Improvement Initiative Proposal, Reducing Hospital Readmission. Greetings to all. I'm going to discuss a quality improvement project today that aims to lower hospital readmission, a problem that has an impact on both patients' outcome and healthcare expenses. Introduction to the health issues. When a patient returns to the hospital within 30 days of being discharged, it is known as a hospital readmission. High readmission rates can have a detrimental effect on patient outcome and are a sign of possible gaps in care. Readmission to hospital provides serious problems for the medical field. They may result in higher rates of mobility and mortality, as well as greater expenses for the healthcare system and patients alike. Our objective is to identify the causes of these rates and put an initiative into place to lower them. Data analysis overview, 30-day readmission rates, patient characteristics, compound conditions, matrix for discharge planning. We examine our facility dashboards indicators, paying particular attention to the 30 days readmission rates in order to find trends that might guide our effect. We also took patient demographic and comorbidities into account. Finding and evaluation of data quality. Concurrent readmission rate 20% over the 15% national benchmark. High risk demographic, patients 65 years of older, or those with long-term illness. Data quality assessment, dependable data sources, and regular reporting intervals. At 20%, our readmission rate is currently much higher than the 15% national average. Target individuals are necessary as the research suggested that individuals with chronic disease and the elderly are more vulnerable. Proposed QI initiative. Reducing hospital readmission. Patient outcome and costs are impacted by hospital readmission, which is why the Quality Improvement Initiative aims to lower rates for patients with chronic heart disease. Supporting data analysts. The goal is to reduce the concurrent 25% readmission rate for chronic heart failure to 20% by examining the patient demographic, comorbidities, and length of stay. Benchmarks. The average readmission rate for CHF in the county is roughly 23%. We aim to reduce this rate by 20% in 3 years, and local systems are aiming to reduce it by 15% through better education and coordination. Strategies for reducing readmission. We will offer traditional care, bill nurse navigators, and telemedicine follow-ups, as well as patient education on self-management and medication. Risk management may be hampered by data restriction, and there are serious issues with resources and minimal patient engagement, particularly in the case of low literacy patients. Hospital readmission impacts outcomes and costs, prompting this quality improvement initiative to reduce rates for chronic heart failure patients from 25% to 20%. We aim for a 20% reduction over 3 years, employing the strategies like traditional care, telemedicine, and patient education while facing challenges in data, resources, and engagement. Target areas of improvement. Key focuses are instructions for patients, setting up follow-up appointments, recollation of medication, sources for assistance. Improving patient education at the time of discharge, making sure follow-up appointments are made, thoughtfully restoring medication, putting patients in touch with the service they need for support are some of the main areas for this focus. Evidence-based strategies to implement. Teach back techniques for education patient, uniform checklists for discharge, collaborating with community health service, utilizing telehealth to monitor. Evidence-based techniques will be used, including the teach-back techniques to make sure the patient understood standardized discharge checklists to make sure nothing was overlooked, and community service coordination to provide ongoing support. Key term members of Quality Improvement Initiative. Nurse navigator provides information about the community and support of the patient. Responsibilities: improve patient outcome and lower readmission rates by managing care, transmission, and offering information on follow-up and set management. Physician, cardiologist. Roles: offer clinical knowledge and treatment procedure supervising. Responsibility: review patient case and modifies care plan based on data analysis to ensure compliance with clinical guidelines, enhancing patient safety and treatment effectiveness. Quality improvement specialist roles: focus on process optimizing and data-driven decision making. Leads readmission data analysts, track benchmark, and shares finding with the team to identify improvement and implement effective strategies. The nurse navigator ensures continuity of care, improving outcome, and reducing readmission by managing transmission and providing follow-up information. The physician reviews cases and adjusts care plan based on data ensures safety and effectiveness. The quality improvement specialist optimize process by analyzing readmission data, tracking benchmark, and identifying improvement strategies. Communication tools, tool to facilitate communication. Miscegenation team meeting. Frequent gatherings foster candidates communication and team unity, presuming that the regular exchanges strengthen bonds and harmonize objectives for patient care. Shared electric health records. A shared EHR system provides access to update patient information, enhancing coordination and reducing error based on the behalf that real-time data improves decision-making. Standardized patient monitor techniques like checklists or dashboard. Make sure that everyone on the team is aware of the status of the patient under the assumption that regular observation results in prompt intervention and well-coordinated care. Meeting with a missionary team improves communication and clarification objectives for patient. Real-time access to patient data is provided by shared electronic health records, which enhance collaboration and lower error rates. Everyone is informed about the development of the patient through standardized monitoring techniques like dashboard and checklists, which guarantee prompt interventions and improve the results. Conclusion and call to action. Lower rates of readmission, enhance commitment along patient, improve coordination of the care, acceptance of the project, resources, pilot phase of deployment. To sum it up, our suggested program seeks to improve patient care and satisfaction while dramatically lower readmission rates. I implore everyone to provide their support and help put this ideal into action. I appreciate your time and interest. I equally await your questions and your comments.